Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, I'm going to share with you 3 cues that you can use to help you walk better after knee replacement surgery. Hey everyone, so walking after knee replacement surgery can be really difficult, and your walking pattern is really changed and different after surgery for a couple of reasons. One is you have, of course, a lot of pain in that knee still, potentially, that you're dealing with, so that's going to cause you to walk with this painful gait pattern. And also what you'll notice is when you're walking after surgery, a lot of people will tend to take very small, short steps. And one of the reasons for this is, of course, the pain, so you don't want to put your weight onto that one leg fully, or at least not do it for a prolonged period of time. And the other thing is your range of motion. So being able to bend that knee and swing it behind you to take that step, you might not have that full knee bending and full knee straightening to take a nice full step. So here are 3 easy cues. So what we want to do is try to improve the length of your steps, and that's going to help make your gait pattern more normal. So one thing is the initial contact. So the first thing that touches the floor when you take a step should be your heel. So sometimes when we take smaller steps, we have what's called this flat foot contact. So the toes or the ball of our foot ends up touching the floor first, or it might be kind of the heel, but more so all of the foot touching first. But when we touch the floor, we want that heel to touch first. So that's cue number 1, is first thing touches the ground is going to be your heel. Now, when you take a step, really what's happening is your whole body is kind of rolling or rocking like a pendulum over your foot. So what happens then when you lift that foot up is you're actually going to push off of your toes when you go to lift that foot up off the floor. So first cue we said was heel. Then as you step over your foot, the last thing should be toes. So you're lifting your toes and you're pushing off your toes as you come up to take that next step. So you may hear the common phrase heel toe, heel toe. This is where it comes from. So heel is the first part that touches the ground. Toe is the last part that touches the ground. Heel toe, heel toe. And then the other important thing I like to tell my patients is just focus on taking a big step. Focus on exaggerating your step, making it so large that it almost feels awkward or uncomfortable how big the step is taking. And when you do that consciously, what's going to happen is when you start walking in your normal, regular activity, you're going to start to compensate, adapt a little bit more, and your steps are going to become more normal. So, taking an extra large step, as big as you can, whenever you're thinking about it. So, big steps, heel contact, toe push off. Heel toe, heel toe. So there's 3 easy cues that you can use to help improve your walking and make it more normal after knee replacement surgery. Be sure to hit the like button, be sure to leave your comments and questions and I'll get back to you. And of course, if you don't already, be sure to subscribe so you can catch all of our great videos about everything related to knee replacement and knee replacement surgery.